Welcome to Going Antiviral, the podcast for the IAS-USA, a professional continuing medical education organization focused on HIV and other viral diseases. I'm Dr. Michael Saag, professor of medicine and infectious diseases at the University of Alabama at Birmingham and volunteer member of the IAS-USA Board of Directors. Today, February 12th, 2026, we are speaking with Dr. Ruanne Barnabas, the Chief of Infectious Diseases at Massachusetts General Hospital in Boston. Dr. Barnabas's research has focused on interventions for HIV and STD treatment and prevention, including vaccination to prevent HPV-associated cancers, such as cervical cancer. She is particularly interested in novel approaches that increase access to services. Her work is focused on identifying effective and scalable HIV, HPV, and infectious disease treatment and prevention strategies that increase access across diverse communities and promote equity in health. Today, Dr. Barnabas joins us to discuss the topic of a symposium session that she is moderating at the upcoming Conference on Retroviruses and Opportunistic Infections, entitled Strategic and Resilient Responses to the Funding Crisis Across Africa. Ruanne, welcome to the podcast.
Thank you so much, Mike. It's great to be here.
It's wonderful to have you, and this is such an important topic. We know from the news that a lot has changed in 2025. So maybe to set the stage, if you don't mind, can you describe for us what the situation was up until December of 2024, coming out of the last administration and transitioning in the United States to the current administration?
I'm really thrilled to say that for global health, we were making tremendous strides. It's been quite exciting to scientifically and clinically be involved in the response to HIV. And in December 2024, we had really turned the tide on the number of new infections for HIV. So we were seeing a 60% decrease in the number of new cases for HIV and a 60% decrease in the number of deaths for HIV. And the trend was continuing to go down. There were new scientific innovations. We had gone from medications that were quite onerous to take in terms of the number of pills and side effects to very simple one tab once a day and at a very reasonable cost. And we were also transitioning now into long-acting agents. We had medications that could work for people who were concurrently being treated for tuberculosis, and we were able to manage most drug interactions and also treat people with many resistance profiles. So in terms of global health for HIV, we were in a good place. And this is globally. It was thrilling, of course, to be able to prescribe at Mass General Hospital and in Somkhele in Durban, exactly this, in KwaZulu-Natal, a few hours outside of Durban, exactly the same type of medication and see the same response to health. Of course, there were many areas where this could be further improved in terms of coordination and efficiency, but I don't want to undersell the tremendous strides in preventing and treating HIV globally and also for other infectious diseases and health overall. Under 5 mortality was at an all-time low. Nutrition was improving globally as well, and we were really seeing the benefits of science and the impact on health improve equity for health throughout the world.
Right. And, a lot of us, I know you have done this, but I did as well. We're working in sub-Saharan Africa in different locations prior to 2004 or just after that, perhaps in your case. But going back to that time, it was pretty dire.
Yes.
And I remember driving around Lusaka, Zambia in 2003, and it was gridlock in the middle of the morning because of funerals.
Yes.
And I came back in 2006 and boom, traffic wasn't held up anymore and people were living and there was excitement in the area. And almost all of this, or let's say a lot of it, was due to the President's Emergency Plan for AIDS Release, or PEPFAR, that George W. Bush put into play in 2004. And it's just been remarkable. And the outcomes you described the 60% reduction in new cases and things like that, we don't even achieve in the United States so
Yes,
far.
yes,
So
yes.
it's striking how effective this was. And um, I mentioned PEPFAR, but one of the biggest changes in the 2025 timeframe was the elimination of USAID. So can you describe a little bit about how PEPFAR and USAID work together and what the loss of funding to USAID did to accelerate some of the declines that we're seeing in the last year?
So you make such a good point, Mike, because often when you think about PEPFAR and the impact it had, we would wish that we had something similar in the US. Because what PEPFAR really did was able to marshal all the evidence and then put together all the global health investment and planning in order to deliver this highly effective antiretroviral therapy, which not only saved the lives of the individuals who received the therapy, but also decreased transmission to their partners and to babies. So it was really just such an incredible intervention for preventing and treating HIV. PEPFAR is the you can think about PEPFAR as the organization and USAID as the implementation arm of the strategy. Really, an incredibly consequential strategy that has that the American taxpayers have had just a tremendous impact on saving lives across the world by preventing and treating HIV. USAID, in doing the implementation, worked very closely with implementing partners, so they were able to figure out who would be able to provide services. They would understand what the networks were like. They would understand where testing would be needed for HIV, and they would also be able to have areas of focus. So, for example, one of the things they focused on was mother to child prevention of mother to child transmission of HIV, which in many parts of the world was reduced to very, very low levels. USAID also created lots of local partnerships, including with faith-based organizations, and this led to sustainable care. And they also collected all the data for management, so we understood what the ART programs were delivering. So you can think of PEPFAR as providing strategic direction and funding. So, for example, countries were able to submit every year their country operating plan. And in addition to this strategic direction and funding, there was really good two-way communication between the countries and PEPFAR regarding what the goals were and how to reach them through the formalization of these country operating plans. There were exciting changes to PEPFAR over the time as well. At first, really an emergency response, then marshaling all the evidence, and then also looking specifically at the data and making changes, and and then also focus on transferring a lot of the responsibility, including funding, to local partners. So it was this process of going from an emergency response to a sustainable program. And in many countries, the work that USAID and PEPFAR did together was the gold standard of how to deliver healthcare, reaching many people, not leaving people behind, and ensuring good health outcomes.
It really was a remarkable effort, and with outcomes that I didn't even begin to imagine when it was launched in 2004. And then the data that you just described going up to 2024 is striking. And so we can think of PEPFAR as the strategic arm and the funding, and then USAID as the implementation, if you will, and sort of the ground troops that sort of make it happen. And to me, at least the USAID workers that I was familiar with and I'd worked with, many of them were former Peace Corps volunteers and then got so taken with working in sub Saharan Africa, for example, that they segued over to USAID where they started their careers and have been there for 10, 12, 15 years, some of them. So they knew the area, they knew the players, and the departments of public health worked very tightly with PEPFAR to make things happen. So it wasn't just HIV, it was a rising tide floating all ships, including nutrition for young folks, and starvation was minimized or reduced substantially. So all that was happening in a way that was very gratifying to be a part of, even if we were working from the U.S. and just supporting this with some of the science. Tell me, when you first heard about the cut in funding to USAID, what went through your mind as you tried to comprehend what that meant?
Just thinking back to the shock and understanding that this network of support for so many vulnerable people was about to be disrupted, was really a very sobering experience. Thinking about how individuals who um, need care, who are in a very vulnerable place, would be affected by cuts in funding, was it was really quite sad, because when you have basics taken care of, like nutrition, and then you're able to be think about the other things that you need to do in life, and you're able to take care of yourself and your family, and pursue other important things in your life. But without these really basic services, I knew that many people were going to be at risk. um, we saw just a very sudden pause. At first, it was a pause in foreign assistance, and then just the next few weeks, terminated or put on hold. And you can think about that as a budget line, but actually, when you think about what that budget was supporting, it was staff salaries, commodity procurement, transport, labs, outreach, partner contact, and and of course all the deep relationships that you had. So, as you said, Mike, we had this system that was the gold standard of how to deliver care, but we also had the system that was available to respond to many things, including things like providing COVID testing and vaccines, and what was needed. And all the expertise that it takes to keep that system going is highly valuable.
Yeah, it was a little bit like more than just a bull in a china shop. It was like a grenade in the
Yes.
china shop, and all this infrastructure and operations that were carefully set up over 20 years, literally, were just uh, destroyed without any regard for the impact. So let's move forward to the symposium at CROI, the conference coming up here in about a week and a half. You're going to be chairing this symposia. Give us a sort of broad stroke overview of what this is going to focus on.
Great. So, the symposium came together because many of us have been feeling the same urgency from different vantage points in clinics, in communities, in research networks, and in the ministries of health. And because the funding environment is changing so quickly, we need to think about what the next steps are. Exactly as you said, Mike, it's not just projects, they are really the backbone of health systems in many settings. So, during the symposium, we want to have an honest look at what has happened and what we can expect. And also, I think about the symposium as the triumph of human intelligence. We're talking a lot about artificial intelligence and what it can do for us, but I also hope to showcase during the symposium what what non human intelligence, and I don't mean it singularly, I mean specifically working with each other, what that can bring to the table. So we have a terrific lineup, and the people on stage will be Solange Baptiste. She's the executive director of ITPC Global, and she will open the symposium with global cuts, local consequences, community impact, and response to the HIV funding crisis. And so this will be the perspective from communities, but also solutions from communities. I don't want to give too much away, but it's going to be a really exciting. The second speaker is Dr. Andrew Kambugu. He's the executive director for the Infectious Diseases Institute at Makerere University, and he will take us into the research and implementation realities with circumventing the cascading crisis, impacts of US government policies on research in Africa, and adaptations. And this is a highly instructive piece because he's going to talk about what the shocks mean for the research platforms, training, partnerships, and the practical adaptations that institutions are already making. And then finally, Jeff Garnett, who's the Dean of the Faculty of Public Health and Policy, will bring the big picture analytic lens with sustaining successful HIV programs across Africa, the impact of shifts in funding, and he'll help us think about different funding pathways, what it means for outcomes, and the sustainability of choices countries and the sustainability choices that countries and partners face. So within the symposium, we're going to move from the community level to the institution level to what the global data and scenarios suggest about the future. And it should be really exciting. So I hope to see everybody there.
Right. And people who are already registered for the meeting, I'm sure will be flocking to this because this is such a hot topic for so many of us in the HIV research and care community. But people can also visit this symposium virtually. And I know that registration is about to close or is just closed, but I think if folks decide they would like to participate or see this or join in more of the conference, they could reach out to the IAS-USA and the conference organizers to see if they can register now, because this is such a great concept. What do you hope comes away? You mentioned what they're going to address, and you're right. We can't go into the details, but we can maybe have another podcast to talk about what was really discussed ultimately. But what do you think folks will walk away from who are able to attend? Messages.
So I'm excited about the community speaker because that will give us an intimate look into what actually happens at the community level. She's also going to share information about early warning signs and what that means at a community level that's different from what we see on dashboards and other types of measures that we look at. I hope that it also gives people a practical sense of priorities, know what to protect first, how to be with patients, how to help our colleagues in the field. And then I hope it's a case study for resilience. I talked about human intelligence triumphing, being able to work with other people. And the third phase of this is how exciting technology is at this time. We just have incredibly powerful medications. We have new ways of being able to deliver them. We have new ways of reaching patients where they are. And these should result in real cost savings. And we deserve to see the benefits of that. And I hope that it will also just inspire people to keep going and keep the focus on global health and on health equity.
Yeah, I'm really looking forward to seeing the symposium and watching it come to life. I also have been working on the board of directors of CIDRS, which is in Lusaka, Center for Infectious Disease Research in Zambia, and that's similar to Kampala, where our second speaker is going to be speaking. But they didn't know what to do. They had relied so long on the USAID in particular in the implementation of a lot of their work, and it was shocking. And I remember sitting on a phone call with the leadership, and I felt like I almost had to apologize for what just happened, even though obviously we didn't have much to do with it. Um, how did this affect your work? And when you mentioned you work in Durban and your group does, um, how did you all respond on the ground?
So, I think one real takeaway from this is how fragile systems can be. And that was very sobering to be able to realize that such a key element was just suddenly gone. So, for example, even things like data, access to data, thinking about not having our own data available to us, and that being a very valuable lesson to know that people were going without services. And I think you talked about the humanitarian aspects of this type of work, including the nutrition work that USAID did was so time sensitive as well. You really can't wait that long or come up with a different plan, and the same is true for infectious diseases. It also made us think about leadership and how to be transparent in these moments, really focus on patients and the people doing the work on the ground. And as we come together and come up with new solutions, let's keep these lessons in mind so that there's local ownership, there's local control, there's not a single point of failure, and that everything we do is designed around sustaining the impact that we're having on health.
Yeah, very well stated and very important. And the resiliency ultimately to hold things together. You mentioned data, and I think when a lot of people think of the word data, they think of its use in research, but the data that we're really talking about here is the implementation data tracking where needs are in terms of supply of drugs or nutritional supplements or whatever it might be. That's how the operations worked, and they rely on those data to make things happen. And the disruption really caused an enormous amount of scrambling at the local level. So our first speaker in the symposium will, I'm sure, bring that to life. Our time is running out. I wonder if we could finish with just your look into a crystal ball. Beyond the symposium, what do you see and what do you hope happens over the next couple of years as the work in, especially in sub-Saharan Africa, continues?
Yeah, my final thought is that HIV has taught us how to build effective public health programs. No doubt about it. Not only in terms of the funding, but also and the organization, but also how to deliver at scale, how to use data for accountability, how to partner with communities, how to innovate quickly, and it really affected every part of the translational health arc, including pushing basic science to produce better drugs, more effective drugs, safer drugs, and now long-acting agents. This crisis it's a real crisis that we're in, but we have the potential to come out on the other side with a redesign that works not only for HIV but for other factors that impact morbidity and mortality. So I invite people to come to the symposium, understand what has happened, think about how together we can collectively find a way forward to preserve equity in health.
Well, I will be there. And on this hopeful note, we're going to have to wrap up. Ruanne, thank you so much for being here, for leading the symposium, for all the work you've done for so long in international settings. And I think you and others like you have made a huge difference in the world. And hopefully that will continue despite some of the choppy waters we're in right now.
It's a real honor to share the platform with you today, Mike. I'm grateful for the opportunity.
Thank you for listening to this episode of Going Antiviral. Catch up on earlier episodes wherever you listen to podcasts, and check out the video versions of this episode and others on the IAS-USA YouTube channel. You can find these links in the show notes, or simply go to YouTube and search for IAS-USA, and there they are. Be sure to subscribe, rate, and review Going Antiviral on Apple Podcasts. This podcast is for informational and educational purposes only and is not intended to serve as medical advice. Opinions expressed on this podcast do not necessarily reflect the opinions of the IAS-USA and its affiliates. And the viewpoints of the individuals on this podcast do not necessarily represent the viewpoints of their institutions. If you have a question you'd like answered on the show, you can send it to podcast@iasusa.org to be answered in a future episode. Thanks for listening.